Welcome to TrecoClinics.com. I'm Dr. Scott Hadley. In this video, I'll teach you the self-correction technique for deep gluteal pain, also known as piriformis syndrome, or pain on the back side of the hip. One common problem in runners is posterior hip pain. This pain is usually felt deep in the gluteal region, so frequently it's called deep gluteal pain. Oftentimes it's referred to as piriformis syndrome, although it's debatable whether the piriformis muscle actually is causing it. Oftentimes, a group of muscles deep in the gluteal region becomes tight because other muscles in the hip aren't functioning properly. For example, the hip abductors, which rotate the hip, if they become tight or weak, the hip has uncontrolled rotation, which stresses the piriformis and the other rotator muscles deep within the gluteal region. It's very difficult to determine whether pain in the posterior hip is coming from this deep rotator group or from a group of muscles on the side of the hip. So, for the purposes of this video, I'm going to demonstrate how to correct both of these groups, the rotators deep within the gluteal region and the hip abductors. That way you'll be sure to reach the source of the pain and symptoms. The root of the problem lies in a muscle of the calf called the soleus. The soleus muscle is the most overworked muscle in runners, and when it gets tight, it creates inhibition of the thigh and of the hip muscles. To correct the soleus, we have to deeply roll through the tissue to loosen it. After that process, we can treat a second muscle in the calf called the peroneus longus. The peroneus longus has a tendon that wraps all the way around the bottom of the foot and helps control toe motion. When the peroneus longus becomes tight, it is responsible for causing muscle tension in some of these deep gluteal muscles of the hip. So the second muscle we treat is the peroneus longus. Since some of the thigh muscles are involved in controlling the hip muscles, we also have to correct the vastus medialis of the quadriceps. When the vastus medialis is tight, the hip abductors become inhibited and they tighten as well. So we must correct third, the vastus medialis. Fourth, we'll treat locally on the lateral side of the hip. And fifth, we'll treat locally in the deep gluteal muscles. To roll the soleus muscle in a seated position,